We want to continue with all developments which we expect in this field, connecting doctors for consultations, planning research, planning training and education, planning guidelines.
EUROGEN is one of the 24 European reference networks that are approved and funded by the EU. Now in its second year, I'm delighted to be joined by the coordinator, Professor Wout Feitz. Wout, thank you so much for joining us. For anyone that's not familiar with EUROGEN, could you just summarise very quickly what it is?
Sure. It's a huge European program which connects different networks and connects also different hospitals over the European countries. Currently, EUROGEN involves 40 hospitals of 14 member states, and we expect this year to expand to the whole European Communion.
We spoke at EAU last year, we spoke to the previous coordinator. What's been happening in the last 12 months since we spoke to you?
Well, thanks to the developments of the Brexit, which we have to mention shortly, I think the coordinatorship has moved to Radboud University Hospital in Nijmegen, Netherlands. And so we want to continue with all developments which we expect in this field, connecting doctors for consultations, planning research, planning training and education, planning guidelines. So a lot is happening actually.
And what would you say is your main focus for the next 12 months?
The main focus will be the extension of the networks by affiliated partners who are appointed by the member states. And there will be a new call for new members who can join the whole network in their full perspectives.
And what is EUROGEN's involvement with the EU Protect programme?
Well, the EU Protect programme will be launched this year, and within the EU Protect programme it's shown how the citizens are protected by the European organizations. Health is an important issue in this. For urology we have 3 different work streams. So from pediatric to functional urology and rare urological cancers. So actually the whole spectrum of the disease areas are covered. Currently in 16 disease areas with all coordinators and teams to work and improve the care for the patients.
What would you say is your vision for what you'd like EUROGEN to achieve in the future?
I think it will be the main goal in improving the care for patients with rare diseases or very complex conditions, and help their doctors by peer help and trust and sharing the knowledge and developing new guidelines, new clinical decision tools, so that we can improve the care in a lifelong perspective.
Well, Wout, I know you have a website if anybody wants any further information that they can visit, but thank you so much for joining us.
Thank you.
EAU TV is brought to you from the 34th Annual EAU Congress in Barcelona. And if you'd like to watch more things like this, then you can click on these videos here. And you can also subscribe for the very best in medicine, from psychology to urology, from gynecology to genetics.